What efforts are being made to support those living with HIV during the holiday season? Well, we don't need to worry. Joining us this morning is the Global Health Sciences Affiliate Programs Prevention and Testing Coordinator, Terry Myrie. Morning, Terry.
Good morning.
Welcome. That's a mouthful.
It is.
Yes, Global Health Sciences Affiliate Programs. Tell me a little bit about the job.
Okay, so we call ourselves UCSF, University of California, San Francisco, and we are working in Jamaica. We're all Jamaicans. We're working in Jamaica, but the project is funded by PEPFAR and CDC, and so we really are on the ground working with healthcare facilities through the Ministry of Health, of course, providing support for persons who are living with HIV.
Okay. So is the affiliate program specifically about HIV or just this specific program that you're doing here in Jamaica?
This specific program is specifically about HIV.
All right. So tell me a little bit then about how does the program advance the work that we're doing here?
Well, you know, it's a multi-sectoral approach, of course, being led by the Ministry of Health. So you have civil society organizations as well who are a part of it. And so it's about providing resources because oftentimes, you know, we are limited in our facilities in terms of what we can provide persons living with HIV, the support, the resources. So we try to find out those needs, the underground needs, and then provide that support.
So talk to me a little bit about those underground needs. What do they include?
Okay, so some of the clients at these health facilities may be from, you know, a poorer background.
Yes.
And so, of course, the basic needs may come into play. So food. So we would help them through the social workers at the clinics to have food vouchers. They can go to Progressive supermarket and pick up supermarket items.
Nice.
So we provide those vouchers for them. They may have a hard time coming to the clinic, so we try to provide travel stipend for those who are in need in that way. And of course, you know, just being there to support them, making sure that persons within the field, the healthcare workers, if there's any sort of training that they need to provide better support, then we are here to help them in that way as well.
I like it because sometimes we focus, not just with HIV, any health issue, on the problem, the health problem, and not the social problem. And as you said, a lot of people living with HIV across the world are vulnerable in many areas, and this will give them an opportunity. And so you identify them through the social workers, through the hospitals. How do you identify them and their needs?
Well, of course, through our clinics. So we have 6 clinics that we work with: Mandeville Comprehensive, Maypen Health Center, Comprehensive Health Center, KPH, San Diego, and Cheers. And so, of course, those 6 sites will have a mechanism for persons who come in, whether for just, you know, regular care, to offer HIV tests. And then, of course, tests are free. You can get them within 15 minutes. And if your result is positive, you will get counseling. Right? So those are the mechanisms, one of the mechanisms to identify. They have outreach programs as well, where they will do, you know, testing. For instance, there was World AIDS Day on December 1st. So we provided support to the sites with testing, not just in HIV, because it is a holistic approach. So we test HIV, but there's also syphilis. We also look at non-communicable diseases. So we look at diabetes. Well, the team, of course, look at diabetes, hypertension, because, you know, when we zero in on just HIV, again, we forget that there are other
issues that are related.
So it's a health approach that we're really pushing.
One of the things I also like about your program is the sustainability of it, because it's easy to come in at Christmas time and say, okay, let me give them vouchers, let me give them, you know, transportation, but you're also supporting the health centers that are providing the support to them. So it means even after a while, they will still be able to access the kind of support that they need for a healthy life.
Definitely. I mean, it is something that we're in there working with them. I mean, we meet with the team. We have a great relationship, both with Ministry of Health as well as the various team members at the clinics. And so our goal is really just to make sure that, you know, our healthcare workers are in a position to provide great care, and that our persons who are living with HIV have what they need to be healthy and live longer.
That's beautiful. Thank you so much. It's come such a far way. We were talking about that earlier. And people, listen, don't allow stigma or anything else, lack of knowledge to prevent you from enjoying a healthy life, because HIV care is there for you. Thank you so much, Terry.
Thank you
for speaking with us. Global Health Sciences Affiliate Programs Prevention and Testing Coordinator, Terry Myrie. News in 5 is up next.